Did you know that your skin and nails may be trying to alert you to a hidden heart problem? That's right. Something as simple as a change in color or texture could be a sign that your heart is in danger. Ignoring these signs can be fatal. In this video, we'll uncover 12 signs on the skin and nails that could indicate a serious heart issue. Heart and circulatory problems affect the skin and nails in ways that often go unnoticed. It's surprising how small changes in appearance can signal something more serious happening inside our bodies. Many people don't even realize they could have heart issues due to the silent nature of this disease. It's known that 14 million Brazilians have heart problems, but what's more alarming is that a quarter of these people have never seen a cardiologist. This means many people could be living with a ticking time bomb without knowing it. So, how can we identify these subtle signs? Our skin and nails can provide valuable clues about what's happening in our hearts and circulatory system. Throughout this video, we'll explore 12 changes you can observe that may indicate the need for a visit to the cardiologist. We'll discuss each of these changes in a simple and direct way so everyone can understand. And it's important to remember that we're not here to create panic, but rather to provide information that can help save lives. Sometimes, a simple observation can be the first step in detecting a serious health problem and treating it in time. So, stay with us and discover how small changes in your skin and nails can be important signs that your body is trying to send you. And if at any time you identify with any of these symptoms, don't hesitate to seek medical help. Let's learn together more about taking care of our hearts. Imagine you're taking care of your skin as usual and suddenly notice something different, like red patches with raised and irregular edges. You might think it's just a simple irritation or a passing allergy. But what if I told you these patches, known as erythema marginatum, could be a sign of a serious heart problem? That's right, these patches could indicate rheumatic fever, a condition that can cause serious damage to the heart valves. Rheumatic fever is an inflammatory disease that can occur after a streptococcal throat infection. What many people don't know is that this condition can seriously affect the heart, especially if not treated properly. The heart valves, which are essential for the heart's proper functioning, can be permanently damaged, leading to complications that can change a person's life forever. It's scary to think that something seemingly harmless like a skin rash could be the first indication of such a serious problem. Many people ignore these signs, thinking it's nothing serious. But the truth is our body often gives us clues when something is wrong. The question is, are we really paying attention? I know people who have been through situations like this, where something small turned out to be a much bigger problem. A friend of mine, for example, noticed these red patches and didn't think much of it. It was only when she started feeling excessive fatigue and chest pain that she decided to see a doctor. The diagnosis? Rheumatic fever with damage to the heart valves. Fortunately, she received treatment in time, but not everyone is so lucky. That's why it's crucial to pay attention to these small changes in our body. If you notice red patches with raised and irregular edges, don't ignore them. See a doctor and get the necessary tests done. Now that we've talked about erythema marginatum, let's move on to the next sign that could indicate a heart problem: subungual hemorrhages. Have you ever noticed small lines or dark spots under your nails? Maybe you thought it was just a knock or some minor injury. But what if I told you this could be a sign of something much more serious, like bacterial endocarditis? Yes, these small dark spots could be an alert that your heart is in danger. Bacterial endocarditis is an infection of the heart valves or the inner lining of the heart. It may seem distant and rare, but the truth is anyone can be affected, especially those with pre-existing heart problems. And what's more frightening is that this condition can progress rapidly and cause serious damage if not diagnosed and treated in time. I remember a case of a close friend. He was always very active, loved playing soccer and hiking. One day, he noticed these small dark lines under his nails and didn't think much of it. He thought he had hurt himself during a game. However, a few weeks later, he started feeling extremely tired and feverish. He went to the doctor and, to his surprise, was diagnosed with bacterial endocarditis. João needed intensive treatment with antibiotics, and luckily, he recovered. But the situation could have been much worse if he had ignored these signs for longer. These small subungual hemorrhages may seem harmless, but they are a reminder that our body often gives us signs when something is wrong. It's crucial to pay attention to these subtle changes and seek medical help at the slightest sign that something isn't right. Have you ever felt painful lumps at the tips of your fingers and couldn't explain how they appeared? These small nodules could be an indicator of bacterial endocarditis, a serious infection of the heart valves. Osler's nodes are a body's response to inflammation caused by bacterial infection in the heart. They can appear suddenly and are usually painful to the touch. For many people, these bumps can be confused with other conditions, such as an insect bite or a localized allergic reaction. However, when associated with other symptoms like persistent fever, shortness of breath, or extreme fatigue, they become a crucial sign that something more serious may be happening with the heart. I remember a case I saw in my clinical practice where a patient, Sonia, started feeling these lumps at the tips of her fingers but didn't pay much attention. She thought she had been bitten by an insect while gardening. Over time, however, these nodules started to hurt more and more, and she began to experience recurrent fevers and intense fatigue. When she finally sought medical help, she was diagnosed with advanced bacterial endocarditis. Treatment was started immediately, but the damage to the heart valves was already significant. It's important to understand that our body often warns us about health problems in ways we may not immediately understand. These signs, like Osler's nodes, may seem insignificant at first, but they are a call to seek medical help as soon as possible. Hemorrhagic and red spots on the palms of the hands or soles of the feet. These spots may seem insignificant at first glance, perhaps something you think is just a passing irritation. However, they can be a serious indicator of bacterial endocarditis, an infection of the heart valves. These spots occur due to inflammation and the immune system's response to bacteria in the circulatory system. Often, they are accompanied by other symptoms such as persistent fever, joint pain, and even small painful nodules at the fingertips, as discussed earlier. It's crucial to be aware of these signs and not ignore them, as they can be the first warnings that something is wrong with your heart. An example that comes to mind is the case of Maria, a patient who initially thought these red spots on the palms of her hands were just an allergic reaction. She was busy with work and taking care of her family, so she didn't pay much attention to it at first. However, as these spots became more visible and accompanied by intermittent fevers and a general feeling of malaise, she decided to see a doctor. The diagnosis was surprising. Maria had bacterial endocarditis. Fortunately, she sought help in time and started the appropriate treatment, which involved the use of strong antibiotics and frequent monitoring of heart function. Today, Maria is well, but her case serves as a powerful reminder of how small changes in our skin can reveal serious health problems. Psoriasis is an autoimmune disease that causes inflammation in the skin, often manifested by red patches and scaling. What many people don't know is that psoriasis affects not only the skin, but is also associated with an increased risk of developing atherosclerosis, a serious condition that can lead to heart disease. Imagine dealing with the daily discomfort of psoriasis, trying to control the patches on the skin that sometimes itch and burn. You're probably dealing with a lot already, but know that this condition may also be alerting you to your heart health. It's a reminder of how interconnected our body is, and a skin condition can be an indication of internal problems, such as heart health. Now, about digital clubbing. Have you noticed your fingers looking swollen, almost like sausages? Or your nails curved downwards, giving a spoon-like appearance? These changes in the extremities can be a warning sign of problems in both the heart and lungs. Digital clubbing is often associated with conditions such as congenital heart disease, chronic lung infections, or lung cancer. I remember a case of a patient I consulted, Lucas, who started noticing his fingers becoming more rounded and his nails curving downward strangely. He was worried about this, but took a while to seek medical help because he didn't associate these symptoms with heart or lung problems. When he finally saw a specialist, he found out he had an underlying heart condition that needed immediate treatment. These signs, like psoriasis and digital clubbing, are examples of how our body can warn us about health problems that go beyond what we can see on the surface. Livedo reticularis appears as reddish or purplish patches in a net-like pattern on the skin, often seen on areas like legs, arms, and trunk. These patches are not only aesthetically different, they can also indicate circulation problems, which in turn can be related to heart problems. Imagine looking at your skin and noticing these net-like patches that seem to be below the surface. They may seem harmless or just a change in your skin's appearance, but they can indicate something deeper going on with your circulation and heart health. I remember a case of a patient, Sophia, who noticed these patches appearing on her legs and didn't think much of it. She thought it was just a reaction to the cold weather, or perhaps a minor irritation. However, as time passed, these patches became more prominent and started to worry her. She decided to see a dermatologist who, after further tests, referred her to a cardiologist. The diagnosis was surprising. Sophia had underlying circulation problems that were affecting her heart. She received treatment to improve her circulation and manage her heart health, but her case serves as a reminder of how important it is to pay attention to changes in our skin and seek medical help when needed. Now, let's talk about Janeway lesions. Have you ever noticed painless red or purple spots on the palms of your hands or soles of your feet? These lesions may seem harmless at first, maybe something you brushed off as a minor irritation. However, they can indicate a serious problem with your heart, such as bacterial endocarditis. These lesions are caused by the deposition of immune complexes in the blood vessels of the skin, usually in response to bacterial infection in the heart valves or the inner lining of the heart. They can appear suddenly and are often painless, which can lead people to ignore them or not seek medical help promptly. I remember a case of a patient, Eduardo, who noticed these lesions on his palms and didn't think much of it at first. He thought he might have accidentally injured himself while doing some household chores. However, when these spots didn't go away and were accompanied by episodes of fever and fatigue, he decided to see a doctor. The diagnosis was concerning. Eduardo had bacterial endocarditis, an infection of the heart valves that required immediate treatment with antibiotics and close monitoring of his heart function. Fortunately, he responded well to treatment and recovered, but his case serves as a reminder of how important it is to pay attention to changes in our skin and seek medical help when needed. Periungual capillaritis can be a relatively common condition, but what many people don't realize is that it can sometimes be a sign of an underlying health problem, such as systemic lupus erythematosus or rheumatoid arthritis. These autoimmune conditions can affect various organs in the body, including the heart. Imagine noticing red or purple lines or spots around your nails and not knowing what they mean. You might think it's just a minor irritation or a result of your nails being constantly exposed to water or chemicals. However, these changes in the nail bed can sometimes indicate something more significant happening inside your body, such as inflammation that may affect your heart health. I remember a patient, Beatrice, who noticed these changes around her nails and didn't think much of it at first. She thought it might be related to her work as a gardener, where she frequently had her hands in the soil and was exposed to various substances. However, when these spots persisted and were accompanied by joint pain and a general feeling of malaise, she decided to see a doctor. The diagnosis was unexpected. Beatrice had an autoimmune condition that was affecting her heart health. She received treatment to manage her symptoms and protect her heart, but her case serves as a reminder of how important it is to pay attention to changes in our nails and seek medical help when needed. If you have any questions, please leave them in the comments below, and don't forget to subscribe to our channel for more videos like this one.